This is lower limb pathology. I'd like to talk about those a little bit, but again, there will be some redundancy, so I won't spend a whole lot of time here. We can have bony cysts in any area. It's a benign fluid-filled cyst, very common in the knee, but they can be found in other places as well. They are not necessarily cancerous, but they can cause pain and complications for patients. The patella is a very large sesamoid bone, and you can see some different things around that area that are unique to the knee, and skyline views are often taken. MRI is best in the knee area as well, because often injuries are more soft tissue related than bone. Enchondroma is a benign tumor found in the bone of the hands and feet. Often they would lead to a pathological fracture because often these tumors just break down the one structure and make the bone weak and more susceptible to further injury, and often that's how they will be found. The patient will come in with an injury and they will find the tumor, and quite often the fracture happened because the patient had one of these tumors first. And then we also talk about different tumors and fractures. I want you to for sure be able to name the fracture that are common in these areas. Gout is a form of arthritis. We've talked about osteoarthritis and rheumatoid arthritis. Gout is very common in the feet and ankle area, so that's why it's in this section. You can also have joint effusions in the lower leg, just as I talked about in the upper. And again, this could be blood or it could be joint fluid. Multiple myeloma is the most common primary bone cancer. And there are a couple images on this slide for you to see multiple myeloma. Osgood-Schlatter disease is a disease where the tibial tuberosity breaks away from the tibia because of the patellar tendon pulling it away. This is very common in adolescent ages, 10 to 15, who are growing quite quickly, and that tendon just pulls away. If you page through the PowerPoint, there's some other images of tumors in different kinds, again, like we've kind of already talked about in the previous PowerPoints. Rickets was more common in the olden days. I don't have a specific year, but in the olden days, rickets was quite common, and it ended up being that the patients went kind of bow-legged, and you can see people these days that if they are bow-legged, it maybe happened because they had rickets or a high fever and so forth in the past. Rickets is a lack of bone mineralization because of a deficiency in either calcium phosphorus and or vitamin D. And the legs bow because the bones are so soft and they can't take the weight of the body. And again, here's another example of Paget's disease, this time in the ankle. We've kind of already talked about this in the previous PowerPoint. Reiter syndrome, it affects the SI joints, and mostly in men. You are apt to see some of these if you work with an orthopedic person, obviously, or maybe a neurosurgeon might also have some of these patients. Also a pain management physician. So not all of these are diagnosed or treated via plain x-rays. More often special imaging such as MRI or CT and maybe pain management type of exams are done. But make sure to familiarize yourself with the different pathologies in the upper limb, lower limb, and the shoulder. And always, if you have any questions, please contact me.